مرحبا بكم جميعا وحياكم الله في هذه الورشة التفاعلية. سعداء جدا بمشاركتكم في برنامجنا التدريبي الذي ننظمه في هيئة أبو ظبي للطفولة المبكرة بالتعاون مع شركائنا. نسعى في هيئة أبو ظبي للطفولة المبكرة إلى دعم مسيرة التنمية الشاملة للأطفال وتعزيز رفاهيتهم منذ فترة الحمل وحتى سن الثامنة، وضمان نموهم في بيئة داعمة وآمنة وتعزز وصولهم لموارد وأدوات إبداعية ومبتكرة، وحصولهم على خدمات متكاملة وذات جودة عالية تساهم في تطوير مهاراتهم وتحسين قدراتهم. لذلك نحن حريصين على تمكين شركائنا وتعزيز قدراتهم لدعم التنمية الشاملة للطفل. هذا البرنامج تم تصميمه خصيصاً للعاملين في قطاع التعليم المبكر والحضانات بهدف إثراء خبراتكم وتنمية مهاراتكم في مجالات الطفولة المبكرة وصولاً لتحسين جودة التعليم وتحقيق رفاهية أحبتنا الأطفال من خلال التركيز على 4 مجالات رئيسية هي الصحة والتغذية، حماية الطفل، الدعم الأسري، إلى جانب الرعاية والتعليم المبكرين. نتمنى لكم مشاركة ممتعة ومفيدة ومداخلات ثرية وقيمة، ونتطلع للالتقاء بكم مجددا في برامجنا المستقبلية. نشكركم مرة أخرى على حضوركم ومشاركتكم، ونثمن لكم جهودكم في تنمية ورعاية أحبتنا الأطفال.
Hi, good evening, everyone. Thank you for joining us this evening for a session. Our trainer today would be... Sorry about that. So our trainer today is May Zalat, and she'll be assisting us in understanding how to deal with children of determination. Before we start the session, I would like to update everyone on the certificates. I had said this in the morning, but I was not sure if everybody who's attending tonight was in our session in the morning. Until now, we have sent about 210 certificates out. There has been a slight delay, but it's okay, it's all gone out now. And I'm hoping that before the start of Ramadan, all the certificates, all our backlogs will be cleared. By this morning, I think we had sent out about 182, and by tonight, 210 have already been sent out. So if you have not received your certificate, please be patient. You will very, very, very shortly. Thank you. The floor is yours, May.
Good afternoon, everyone. I'm so happy to be with you today. I'm May Zalat. I will be a trainer today and I will be talking about how to support children with additional need. We will start off the new terminology that we are using in the UAE, which is people of determination or children of determination. So under the leadership of Sheikh Mohammed and through the focus of the new initiative, My Community is a City for Everyone, KSGA has the privilege or had the privilege to work on the leading inclusive work frame and task force. It doesn't take only one person to change or to include the children who has special need or additional need, but it takes the whole community. It doesn't take only one teacher, it takes the whole community of the nursery that you're in or the school that you're working with. So starting from administration staff, going to teachers, teacher assistant, hygiene specialist, the manager of the nursery, and the SEN coordinator, of course. To be able to really include the children in our community, in our nursery, or in our setting, we have all of us to work together to be including him. That's why we need to explain more what is inclusion. There are different things between inclusion, exclusion, and integration. And sometimes we think that we're including the children, but to be honest, it will be integration, not inclusion. Let's start from the beginning. Exclusion is when that I don't accept the child who has additional need or a child of determination in my setting for a direct person or direct reason or indirect reason. Sometimes you will be receiving, for example, we will be telling the parents, we don't have spaces. However, we do have spaces, but we don't want to welcome the child of determination in our setting, which is exclusion. Sometimes we'll be saying, for example, our teachers are not trained enough to welcome your child or to register your child in our nursery, which is as well, it's exclusion. We cannot exclude any of our children from education, because education in the community is for everyone. The integration, I would say, which is another type. Integration is when I welcome the child in my setting, or I let him register in my setting. However, the teacher will be unwilling to change her approach, unwilling to change her way of dealing or her way of teaching. We will be just welcoming the child in the classroom, and we will not change anything to suit the child. And this is not inclusion, this is just integration. The inclusion, fully inclusion, is when I welcome the child of determination in my setting, in my nursery, and I change everything to be suitable for him. I change my way of teaching. I change the setting of the classroom if it's necessarily. I change the way of communication. So if a child, for example, he has speech delay and he's using a different way of communication or method of communication, like Makaton or sign language or PECS or any different method. So my teachers, the whole nursery, actually the whole setting has to be trained to be able to deal with the child or to communicate with the child. If, for example, a child has physical delay, we need to make sure that the nursery is suitable for him to be able. I will not put him, for example, if it's 2-level setting, I will not put him on the second floor, for example. So we have to make everything suitable. And when we accept the children of determination in our setting, we have to fully include them. Sometimes as well, we have to change the curriculum for them. So they don't have to follow, or they will not be able to follow the same curriculum or the framework we're using in our setting. So we have to put that into consideration, and we have to train our teachers. And as teachers ourselves, we have to be ready to welcome the children of determination in our nurseries as well. Now we will talk more about inclusion, because as we said, inclusion is what we want for our children in the whole community and in the setting, in the education. It's because education is a right for all the children. So we have to ensure that admission is not into all education setting will not be conditional upon the submission of medical diagnosis. When we go, for example, and submit the registration forms to any of the settings, when we see if a child, he has autism, for example, or he has Down syndrome, or he has any other additional need, we don't have to reject the child directly or indirectly for his medical diagnosis. Inclusion is not to offer the children the same learning opportunity, but is to ensuring they have the access to quality education for all students. And as early years educators, all of us, we know that all the children, they learn individually and they learn in different ways. So not all of us will learn the same way and the children the same. So we don't have to expect that I will do the one activity and it will be suitable for the 10 children that I have in my class. We have to put in mind that I have to offer him the quality, or give him the access of the quality education that it will be suitable for that child and for all the children, of course. Inclusion is viewing and valuing the diversity. We have to value diversity. Diversity is not only when I value different nationality and different culture, which is perfect, and we see it here all the time in Dubai and the UAE. However, it's really important as well to welcome and to include all different abilities. Not all the children has the same abilities, and we have to welcome that and we have to respect that. We have as well to include all the children, especially in early years. We have in our activity, we have to promote the child-centered activities. So we have different learners, different type of learners in children. So some of them, they are physical learners, some of them, they are visual learners. So we have to really have a child-centered activity. We have to let the child lead us. So we are not here to teach the children. We are here to facilitate the learning of the child. We have to put in mind that we have to remove all the barriers to learning in diverse student population. So if as we mentioned, we need to add, for example, modify our curriculum, we have to do this modification. If we need, sometimes the children will not be able to use our curriculum at all. So we have to seek for help and get other curriculum which will be suitable for that, only that child. And changing our way of teaching, changing our learning strategies. It's really important as well that we are ready as educators to welcome the child, because believe me, when we are not ready to learn new things, if we are not ready to welcome the child and to change our ways, we will not be able to help the children of determination. We have as well, inclusion is rejecting ability labeling in teaching, along with the idea that some learners cannot learn due to individual abilities or disabilities, as we say. We don't have to put in our mind, for example, that that child, he has Down syndrome and he doesn't write yet. It's fine, he will never write. No, we have to push them. We have to, the limit is our sky, as we say. So we have to encourage them to do more, because even if with children of determination, they are totally different. So if you have two children, for example, who have Down syndrome in your setting, not in the same class, but in your setting, and the same age group, the same everything, you will find the abilities is totally different. You find their way of communicating, their physical development. So we have to deal with each child individually, and we don't label their abilities. The label SEN. When we say SEN, which is special education need, it's not a specific term that we can use, because it doesn't talk much about the student and his ability or his learning abilities. As it meant the learning difficulties faced by some children, which require special education facility. So this lack of specification can create a lot of issues. So when we come and we say to our, for example, our educators that you have a child who has special education need, that's it can be very vague for the educator. We have to specify what does the child have and how we can go further with him, how we will be able to help him. Because if I don't know exactly, as educator, if I don't know exactly what the child has, I will not be able to help him. However, the special education need or SEN terminology, it can be used when we need to modify something in the setting, like we mentioned earlier. If a child has a physical delay and we need, for example, to get the FS2 class on the ground floor, for example, for him, or to make the classroom accessible for him. So the kind of things or modification in our setting, we can call it special SEN, which is special education need. However, when we welcome child in our setting, we need to know exactly what does he have. We need to get a report to be able to help him. Direction of the staff with children, children of determination or children with special education need. There are three different types of reactions actually. The first one, some of them, they feel like there is something wrong. And when the child, with the child actually, and they start thinking on how we can solve this problem or how we can address this problem. And this reaction, seeing that the child difference has to be treated like a disease. And this is a very negative method. Sometimes we don't know, sometimes they don't mean to react like that. However, maybe because they have a fear of the change, or they have a fear of how to deal with the child, will make them react like that. The other reaction, which is some of the educators, they will look at the child with sympathy. So they will be like, they are concerned about the child's well-being, and the situation is seen like a tragedy for the parents and for the parents and for the child himself. And still, when we deal with the child as we're looking at him or his ability as it's a tragedy, we'll not be able to help him. The third type, which is the type that we want to deal with the child with or accordingly, is to examine the ability of the child like any other child, and to see how we can start from what will be the next step to start with. It's really important to see where is the child now. Even if his ability, for example, if he's 46 months and his ability, or he is able to do things for 8 and 9 months, it's fine. But for me, I know where to start from, and I will take it from there. It's really important to just look at the child, what he can do, and what can I have, or what I have to work on with the child, and we'll take it from there. The goal of special education need, the main goal of identifying the child's special education need is to provide him the individual attention by providing him the additional resources and developing the special method. As we mentioned earlier, when I welcome a child who has a child of determination, my role will be to adjust everything and modify my setting and my classroom accordingly. I have to deal with the child individually. I have to give him individual attention as well. And that's not only with children of determination, to be honest, it's with all early years. So we're always saying especially in early years, we have to deal with each child individually. So with special education needs, yes, it will be a bit step further, that we might change the curriculum or adjust the curriculum. We might change or plan a totally different planning for him, which we'll talk about soon. So we have to respect that. We have to respect that. We have to follow his ability, and we'll take it from there. The first observations and early interventions. So who start doing the observation in your classroom to see, because as we all know, some of the children of determination, they have a diagnosed additional need, like for example, if he has Down syndrome, so they know he has Down syndrome. Some of other children, when they come, he might have, for example, for me as educator, I might see what I see, for example, that he have behavioral issues, for example, like he pushes the children or he bites, but we have to go back of why is he doing that. It might be a speech delay, so he might has only a speech delay, and speech delay is affecting because he cannot communicate with the children, so that's affecting his personal, social, and emotional as well. And from there, who will be the first one to do all these observations is the classroom teacher as educator. So you are, as the educator, you are the first person who will do this observation. So where a child appears to be behind expected levels in your framework or milestone, or where a child progress gives a cause of concern, for example, if he's 3 years old and, for example, he's still repeating 1 or 2 words after a year and he's not confident talking or seeking for help or asking you questions. So then you will understand that that's a bit of concern, so I have to observe him in communication language and to take that further. We have to look, so as educator in the classroom, the first things that we have to look at is the child learning and development with a beyond the setting. So not only in the classroom, because as we all know, the child I might not as the classroom teacher, I might not be the child key person, but for example, the learning support assistant might be his key person. So he might not talk with me or communicate with me or seek help. However, he can go to the learning support assistant because she's his key person. So we have to observe his development and his learning in the whole setting, not only in my classroom with me. Outdoor, some children, they like to be outdoor and they will be more active outdoor, or they will communicate more with their peers outdoor. So we have to observe the child development and learning in all the areas, and we will start taking it from there. The second thing we have to look at is your observations. So as educator, you're doing your ongoing observation. From the ongoing observation, you will start observing, or you start having the concerns, or saying, for example, we need to work on these areas of development or not. The last thing is the progress in the prime areas. And the prime areas, we all the time go back to our prime areas as the base. Prime areas are the physical development, communication, language, social, person, social, and emotional. So if the child is progressing in the prime areas or not, and when we put all these three together, we will start seeing if the child has additional need. Does he need extra support or extra help from us or not? The voice of the child, it's really important as well as a key principle. We put into consideration the wishes, the views, and the feelings of the children. It's really important to know, as we said, we are not there to teach them, we are there to facilitate the learning. So as educator, my role is not to tell him, today we'll learn about cow, here's the template of a cow, and you will be painting this black and white, for example. No, I have to follow his feelings, I have to follow his wishes and his views. Children as well may express their wishes, views, and feelings for themselves in a range of ways, and practitioner, they have to support the interaction with them, with pictures, for example, with visual prompt, like we're always saying, we do a visual timetable for the children to be able, for them to be able to know where are they going, what are we gonna do now, visualizing everything for them, and visualizing the learning as well for the children. It's really important, and it helps them later on to communicate and to show you what does he like and what does he not like. Deciding whether the child has special education need or not. For me, and sometimes it happens with us, that we will have educators coming and saying the child has special education need. And believe me, it might be when we look into it, because we cannot just decide that the child has special education need from 2 weeks observation. We have to really observe the child for up to 1 month to see the child in all different areas, to see the child in all different situations, doing different activities. The child can change his behavior, or the child can stop talking, or something happen, or he will have delay in his area of development, maybe if he has a huge transition in his life. Transition, it can be a small, simple transition, and can be a huge transition. Simple transitions like he was sleeping next to mommy, but he moved to his bed, for example. That's a transition. It can really affect the child emotionally, and when the child is affected emotionally, it can affect his communication, language, his personal, social, emotional as well. Removing the nappy for him, a huge transition if he just came from a different country, for example, if he's coming from China and he knows only Mandarin, excuse me, and he came to Dubai, he just came to Dubai. That's a huge transition, a huge, totally huge transition for him. That he changed the country, he changed the language, new different setting, teachers, peers, and friends, and everything. So we have to put all these things into consideration because that really affect the child emotionally. The key questions that we have to ask ourselves as educators to decide whether the child has special education need or not is that if his learning difficulties is greater than any of his peers, like for example, there's a huge gap between himself and his peers. If, for example, you're teaching 3 to 4 years old, but on the milestone, that specific child X, his development in communication language is 12 months. That's a huge difference. However, if, for example, there's only 6 to 10, for example, month difference, that still can be improved. We have all the time to work on the children because not all the 3 to 4 years old children, you will have them at the same level in all areas of development. And as educators, of course, you know that some of the children, you find them that they're really good high achievers in physical development, but communication language still we need to work on. Or some of them, they're very talkative, they're very confident, but they still work more on understanding the word or math or the phonics. Or so not all the children, we have to put in our mind that not all the children have the same level in all areas of development. The second question that we have to ask ourselves is that, does the child have an additional need that prevent him from using the nursery or from using my facilities? And when I have to change my setting for the child, that means yes, he has or he needs additional need or additional support. The third question is that, does the learning difficulties call for special education provision? And when we say special education provision, we don't say, we have to put in mind or differentiate between two things. Because as early years educators, we all the time doing different levels of activity within my planning. So for example, we're doing an activity for high achievers, we're doing activity for the rest of the classroom, and we have a child, for example, he's more independent in any of the other areas, so I'll do a different activity for him. But this differentiation I'm doing within the same planning that I'm using for the whole classroom. However, to use a special education provision, that means that I do a totally different IEP or a totally different planning for that child, or a totally different curriculum that I will be using for that child. And this is what we call the special education provision, that we are using a totally different one for him. When we identify that a child has a special education need, the first thing that we go to, or the first people that we go to, is their parents. We're always saying that the parents, they are children's first teacher. They know the children the most, and we have to work in partnership with them to be able to help the child. When we know that a child has special education need, we start, that's from the observation, we start following an approach called the graduated approach cycle. And the graduated approach cycle, which is first thing is the assessment. So in all the nurseries, we are required to carry out an analysis for the child's need, or for all the children's need. We have to put alongside as well the parent's view. We have to understand from the parent, what is he doing at home? How is he interacting with others, for example? How is he communicating with others? It's really important to work with the parents closely. And it's really important as well to work with the therapist. If a child goes to any kind of therapist, like speech therapy, physiotherapy, occupational, ABA, we need to work, all of us together, to be able to help the child. If the speech therapist is working on something and we are working on something, and the parent's doing a third different thing, or a third different method even, the child will be lost and will not be here to help him. It's really important that three of us, or whoever is involved in the child development, all of us, we need to work together for the sake of the child. Initially, the graduated approach involves you involve the information, or they're using the information you gathered from your ongoing observation or the day-to-day assessment. So the main person who would be responsible about doing the observation for the child and the assessment for the child it's the classroom teacher or the classroom educator. Because you are the one who will be spending with him most of the time during the day. When we take, if we have any concerns about the child progress, for example, and you want to do more further observation, then you have to go to your special education need coordinator. And now in all the nurseries, we have a special education need coordinator or special education need teacher who has more experience with special education need children or children of determination to take, for example, this observation further and to go more in depth to be able to know what exactly the child has. It's not, we're always saying that we are not special at the end of the day. So yes, we are welcoming all the children in our settings. We are there to help them. We are there to support them, and we are here to modify the curriculum or change our way of teaching and approach. But at the end of the day, we are not specialists. So you are more welcome all the time to seek help from the specialist. You're welcomed all the time to seek help from the speech therapy. What is he using with the child? For the physiotherapy, for example, what kind of activity can I do in the classroom to help him develop and so on. We can, for example, use as well different tools for speech and communication. So for the children who has delay in speech delay, there are different methods. So some they are using Makaton, some they're using sign language, some they're using, for example, PECS, which is the picture, which is a bit like visual timetable that we are doing. And that's why we're always saying especially in early years, we are visualizing everything in the classroom and we are labeling everything in the classroom with the photo of the thing. So if you have Lego, you're putting the Lego, the photo of real Lego, and you're putting the name of the Lego. If you have cars on the tray, you're putting the picture of the cars and you're putting the label, which is the car, and you will take it from there. The SENCO, the Special Education Need Coordinator, she will be the one to arrange any additional assessment. So as we said, the ongoing assessment or day-to-day assessment, it will be done by us, the educators or the classroom teachers. However, if you feel like your observation is not enough to help the child, that will be the time that you will go to the Special Education Need Coordinator or Special Education Need Teacher that assigned in your nursery or setting to help you to do any additional assessment. However, your ongoing observation, it will be our baseline and our foundation for the observation of the child. From our assessment, we'll start doing our planning accordingly. So the planning, it doesn't only include yourself as educator for the planning of the children of determination. However, it has to include anyone who's involved in the child development or the child day, like parents, teachers, and any staff, the learning support assistant, the therapists that they are dealing with him, for example, or he goes to. So all the people who are involved in the child development or in child education, they need to be involved in the planning, because we need all of us to work on the same method, on the same approach, and on the same ways to be able to help the child. This part, which is the planning part, it includes, or in this cycle involves the discussion. And so we are discussing what do we have to do next from the observation that you have done, the planning and agreeing on our targets, because including the parents and the therapists is important, as we mentioned, because sometimes the child, he acts differently when he's at home or when with his therapist. So for example, he might not talk with you at all, but he might start babbling at home, or he start prompting some sounds with the speech therapy, for example. So that's why we need all of us to agree on the plan that we will put for the child of determination. The planning should involve the student, parent, and staff. And when we say student here, when the student, we mean with student views and the student feelings and the student wishes. So if you know that the child, he doesn't like painting, for example, at all, and he's more into physical activities, collecting leaves from the garden, or helping you in the classroom, or any other activity. So we will put the activity that he dislikes aside, and we will work on the activities that he likes to develop the areas that we need to develop. So we have to include the child indirectly with what he likes and what he doesn't like in our planning. Where other professionals are working with the child, they should also contributing in the planning, as we said, like any professional specialist, like the therapist, any Arabic teacher, like Arabic teacher, PE teacher, French teacher, any other teacher who is dealing with the child, and part of his education has to be involved in our planning. The initial step of the planning process includes agreeing targets. So for the student, in order to focus attention on the key areas that we need to work on. After the planning, the target should aim to support the child toward his work and the long-term plan. To be able to do that, we have to, as we said, we have to do personalized curriculum. Sometimes with the children, for example, who has Down syndrome, they are not using the EYFS, or they are not using the British national curriculum. However, they are using another curriculum for for children who has Down syndrome called as DAN, which works more on, yes, academic, but works more on life skills and personal skills and so on. Additional resources, if, as we mentioned, for example, that the child needs more resources, he has sensory issues, for example, and we need to get more resources for him to work on the sensory issues, so we will get more resources. Working on small groups, so usually in early years, we are all working in small groups. However, with a child who has special additional need, we need to really work in small groups, like 1-to-1 or 2-by-2, because sometimes he will be really encouraged by his peers, and he will be happy to do like them and to learn from them. From the assessment to planning, when we finish the planning, when we agree on our targets and what we will be changed in our setting or in my classroom, I will start myself as a teacher to do the planning that we agreed on. So still, it's the classroom teacher responsibility to do the observation and to do the planning with the rest of the team, and to implement those activities in the classroom. So the classroom teachers remain the responsible one for the child, and should work closely with him, and should work closely as well with any other staff who will be involved with that child, like as we said, like learning support assistant, teacher assistant, any other teacher who will be involved in his education, Arabic teacher and French teacher. In practice, implementing that support plan will mean what? Will mean that we have to deliver high quality teaching to the student every lesson. When I have a child who of determination in the classroom, I don't have, for example, if he's there from 8 to 2, so I will not do only one activity, which is high quality teaching activity with him, and the rest he will be lost just following the others. No, we have to have proper plan for him. What is he gonna do? Believe me, when a child has any delay in any areas of development, any of the 7 areas of development, when he feels he's lost and he cannot follow up with his peers and his colleagues in the classroom and his friends, you will find yourself having a lot of behavior issues in the class. And not all the teachers will understand that yeah, because I'm not giving him the right activities, I'm not giving him the right approach, for example, I'm not offering him the right approach. So we have to give him high quality teaching in or in every lesson, the classroom, the circle time, when we go to wash our hands, for example, the first activity, the outdoor, in all lessons. Implementing any adjustment, specific strategies, as we said, approaches, my teaching, for example, the way of teaching, how do I approach the child? All that has to be identified in the IEP, which is the planning that we'll do individually for the child, and we'll explain it more later. Managing as well the teaching assistant, as we said, we have to support all the teaching assistants who are dealing with the child to be able to help him more. Communicating regularly, we have to communicate all the time and to keep assessing all the time the child to be able to know if he achieved the development that we want him to achieve and our target or not. The fourth step in the graduated approach cycle, which is the review. So we have on regular basis to review all the development, or what the stage that, what did he achieve or what did he not achieve. Usually we have to do it, or we can do this review in each parents meeting that we have, usually 3 times a year, so once a term. However, if the child achieved or one of the targets earlier than the parents meeting, we can do an early meeting to be able to work on another target. I don't have to wait till the end of the term to tell the parents, for example, and the therapist that he achieved that target and now to work on. No, we don't want to lose any opportunity. And that's why we have, when we feel like the child, he achieved something in our IEP, then we will have a meeting with the parents and therapists and tell them he achieved that, what will be the next step, and we will take it further. Now we will come for the individual education plan, which is the IEP, which is the planning that you will be doing for the child. It doesn't look like a proper planning, but it looks like the targets that you want to put for that child on the long term. Usually, as we said, it's for the whole term. However, if the child achieved any of those earlier, we're more than happy to be updating that all the time. So the IEP, it's a legal document which describes the child's special education need and what he will get from us to meet his need. So as we said, decision about the content of IEP, it should be made openly with parents, teachers, and whoever is included in the child education. Therapists, French teachers, PE teacher, anyone who's included in the child education has to be involved in the IEP. The IEP should be clear how the child or the young person has contributed to the plan and how their view reflected. If the child, for example, he liked the way that we are using to communicate, like the text, or he didn't like it, so would be able to use another method. If he liked, for example, Hackathon, okay, so we will start promoting Hackathon, for example, and teaching training our team members and training his peers, for example, or let them teach them all together, for example, every week a new word, and so on. The IEP as well should describe positively what the child can do and has achieved. So it's really important to all the time concentrate and promote in a positive way what the child is able to do and what will be the next step. Believe me, the parents, the therapist, and everyone who's working with the child, they know that he's delayed or he has delayed in any of the areas, but we don't have to approach them negatively and to have this negative attitude. Our IEP, it has to be as positive as it can be of what the child can do now, which is really good. And from that, next step would be working on 1, 2, 3 in different areas of development. The IEP should be clear, understandable, and accessible as well to everyone. So what we are doing actually in the nurseries now, We ask, for example, if you have a child who has Down syndrome or he's on the spectrum, or any other child who needs additional support, when he goes to the speech therapy, for example, we will ask the report from the speech therapy, or the plan, what he will be working on with the child, and that the parents will share it with us. So all of us will be working on the same things. And usually the therapists, because they are the specialists, they are the professional specialists, they will give you ideas of activity. And believe me, those activities will be suitable for all the other children in your classroom. So they will give us ideas of activities and way of approach that we can approach the child with, and we will take it from there. So it's really important, as we mentioned earlier, that to work all of us closely together to be able to help the child. In preparing the IEP, the SENCO, which is Special Education Need Coordinator, must consider how best to achieve the outcomes for the child. The SENCO must take into account the evidence received from the teacher. So we will go back to the first point, which is the teacher is the main person we have. So you as educator and you as a classroom teacher, you are my main person that I go to, because you are the one who's doing the ongoing observation. You are the one who's doing on daily assessment, excuse me, and daily observation. You are the one who's doing the activity with him actually that we planned, and you will be the one who's reviewing what did he like, what he disliked, and what he achieved or not. So you are the main person for me when we are dealing with children of determination. And as we mentioned, the IEP should have a review date, which is usually 3 times a year at the end of each term with your parents meeting. However, if you would like to meet the parents earlier, that will be good. If a child achieved, for example, any target, or you find that the targets that you put in your IEP were really high for him, and you want to put other targets, it's still fine for you to call the parents and the therapist earlier to discuss everything further. Excuse me. The IEP, the Individual Education Plan, it's a smart document. And when we say it's a smart document, we mean like 5 things. Specific intervention. We don't have, it doesn't have to be vague and a general thing. No, IEP has to be very specific. What are the areas we'll be working on? Not even the areas. In each area, like for example, in communication and language, what I will be working communication language for that child. So I'll be working, for example, for him, asking to go to the toilet, for example. That's a development that I want him to achieve. I want him to seek help. So he will be able to go and ask for something or ask for help from an adult. So we really have to specify the intervention or the target that we are having. The second thing, it has to be measured outcomes. Doesn't have to be a general outcome, no. We have to, it has to be measured like, now he's asking to go to the toilet, so pick, we're done with this target. It has to be really specified and really simple for us to be able to achieve. It has to be achievable targets, as we said earlier. I don't have to put a really high, for example, targets for the child. Believe me, he will get frustrated and you will start seeing behaviors you don't want to see. You will start seeing, he will start feel depressed because he doesn't know what to do. And when you start asking him things, he doesn't know what to do. How to do it, believe me, he knows his ability the best, the child, even if he's 2 years old. If you're sitting with him in an activity that he knows how to do or he's able to do it, you will find him enjoying his activity. However, the second that you start giving him something that he's not able to do, you will start finding him looking around, you start finding him starting pushing another child, or he's distracted. Not because he's distracted, no, because he knows his ability and he knows that he cannot do this or he's not able to do this. That's why we have to put achievable targets for him. And still, you will be the right person still to go to in the nursery and as well the parents at home. Relevant and result-oriented activities. So we have to put relevant activities for him and for his ability as well. And the last thing, or the fifth thing, is time-sensitive measures. So as we said, we will put a term. We don't want to put, for example, target and say, okay, we'll work on this target for the whole year. The children, we don't want to miss, and we don't want to regret that we missed any of the development, because sometimes it's too late to work on few things. And the best thing that we are doing, or best, I'm always saying that we are in early years, we're having the best working place, because we are the foundation. We are the ones who can really help the child, who can really promote the early intervention, and to help the child later on when he goes to school, he will be ready. Special education need coordinator. So as we all know, now in all the nurseries and all the settings, early learning centers, we have special education need coordinator or special education need teacher in the setting that she's assigned, and she has more experience, or she has more qualification of dealing with children of determination. So that person, she will be the one that I go to when I need further observation, for example, or further assessment. I go to her, for example, if I'm out of activities, or I don't know how to approach the child in the right way. And it's not wrong all the time to seek help, because no one of us is the best in everything. You will be really good in art, for example. The other teacher will be really good in delivering math, for example, activities, the other in literacy, phonics. And so everyone is really good in something. So that's why I'm always saying that it's really important not to be shy to seek help from a special education need teacher, or another teacher who worked with another child, for example, who has the same additional need. So we can go and ask her for help. Cooperation, coordination, and partnership. Working together, it's an essential feature of effective inclusive education. So working together, not only, as we said, working together as teacher or parents, educators, parents, and therapists. No, working together as well as the nursery or the setting community, the whole community. If a child, for example, he has a speech delay, excuse me. If a child, for example, has speech delay, and you are the only one who knows how to use Makaton, for example, with him. However, another teacher assistant took him to the toilet and he wants to communicate with her, and he started communicating with his method, which is Makaton, and she doesn't understand what you're talking about, or what is he talking about. He will start getting frustrated. So she will either find him screaming or frustrated, or he will start pushing anyone else, or he will push her away. So all these things, she will come back to you, she tell me, X child, he did 1, 2, 3. Actually, no, he didn't do that out of nowhere. He did that because he wasn't able to communicate with her the way that he knows that he can communicate with others. So if a child, for example, even if it's a huge school, and you have 1 or 2 children who are using Makaton, for example, in the school, the whole school has to be, at least they know how to do the simple Makaton signs, like good morning, how are you, good job, toilet, and the main thing that the child might ask or might need when you are not there. And that goes for all the development or all the abilities. We have to be there as a community. It doesn't take, we're always saying inclusion doesn't take only one person. It takes the whole community, from the whole, everyone working in the setting, parents, therapists, and everyone. Collaborate to ensure all students, especially those who experience special education need, are well prepared with the skills and ability to take further education. We don't have to jump with the targets or to do a really high achievable target without making sure that the child is on a safe place or a safe level that we can take this next step. We don't want the child to rush in the development to be able to see for, oh, wow, he developed. No, we want to make sure that he developed these targets 100% for me to be able to go to the next step. Work together to monitor and evaluate the quality services provided to the student and the families as well. As we said earlier, parents are the key members of the IEP, Individual Education Plan team, as they know their children very well and can talk about their children's strengths and needs really good. You all know, and it's always happening in early years, you might go to a parent and you tell her, my child is very shy, he doesn't ask me any questions, and she tell me, he doesn't stop talking at home. So believe me, the children, they are totally different with you. Rather than they are dealing with their parents and how they are communicating with their parents, because it's their comfort zone at the end of the day. So that's why we have to include the parents in everything. And we don't have to judge even in the assessment or the ongoing observation period. Before we assess the child or before we give a report about our assessment, we have to discuss with the parents, how is the child dealing in these areas that I have concerns for at home. For example, he just joined a nursery, for example, 2 weeks ago, and still he doesn't play with anyone. But the mother should tell you, he's very social and at the park, and he goes all the time to the park and plays with all his friends, because he knows those friends. But with us, it's just still the settling in period. So he doesn't know all the people or all the children that we have in the classroom. That's why he deal with them or deal with us differently. So that's why we really need to include all the time the parents. Teachers, as we said, you are our team, the dream team that we're having. So teachers, they are the ones who are responsible about the planning, about the ongoing observation, about reviewing as well what the child like or dislike. So you are the main person that we will go to all the time. We're always saying that if you're unwilling to welcome the child or unwilling to take the step further and to do more effort to really let the child develop his development or achieve his target, he will never go anywhere without you. The last slide with us today is that we need to ensure that the classroom teachers or all the early years educators working in an inclusive common learning environment will demonstrate and apply knowledge and understanding of inclusive education, values and principles. We are not expecting from all the early years educators or learning support assistant or teacher assistant to understand the principle of inclusive or, for example, education. However, we have the main thing that they have to understand that we have to deal with all the children the same way. But doesn't mean that I have to offer them the same things. No, I offer them the same things suitable for them. So for example, as we mentioned earlier, if a child, he enjoys all the time painting and messy play but another child, he loves all the physical activities. So both children, they can develop the same areas of development or to achieve the same development, but in totally different activities or approach or method. So we have, and this is inclusive, this is how I look at each child individually. Be proficient in inclusive education techniques, curriculum modification, personalization, as we said. It can be a super simple thing or a super simple adjustment to your way or to way of teaching or to your approach, but it will really help the child to improve and to develop to achieve his development. And last thing, work with parents and caregiver professionals to develop appropriate IEP, achievable IEP, and not to rush the children and their targets, and not to take too long. Don't say, for example, I will ask the child, or we will work for the child to be able to jump. For example, if he has a physical delay. So he walked and he stopped, so he doesn't know how to hop, for example, or jump. And would say, okay, the whole year we'll be working on this. No, we can work, we can push this further, but I will not finish it in 2 weeks. So it doesn't have to be really short, it doesn't have to be really long. It has to, for you, and when you know your children, you will understand his ability. So you say, for example, with X child, he might, let's take 1 term or let's take 2 months. And if he did it earlier, if he achieved it earlier, we'll go to the next step. That was our presentation for today. I think we have some questions.
Thank you, May, for the presentation. I'm not sure if we have time to answer them because we do have just 1 minute left. But what we will do is we would answer the questions offline and send them to everyone who asked them, or we can send them with the email, the answers.
Perfect. I would be more than happy to do so. Thank you so much for attending today's session, and it was my pleasure to introduce everything more to you. Thank you, Rafi.
Thank you very much, everybody, for your time. Thank you, May, and hope to see you next Saturday. Bye-bye.
Thank you. Bye.